But in reality, it's not just the singers who have to care for their vocal health. Yung always clearing the throat, is that bad for our vocal health?
Well, actually, yes. It's
It is.
vocally abusive. It's a vocally abusive behavior. Pianist has the piano as his instrument. Violinist with the violin as her instrument. We have our voice as our own instrument.
Everybody needs to have a voice. Good day, everyone. I'm Dr. Jing, and welcome back to MD in Focus, the show where we bring you valuable health tips and recommendations straight from our St. Luke's experts. We're diving into the fascinating world of vocal health. So grab a cup of tea, sit back, and explore the secrets of maintaining a strong, healthy voice. I'm here with Dr. Maita Feliciano, an otolaryngologist from St. Luke's. Doc Maita, so voice disorders are more common than we think. And it doesn't just affect our singers, diba? The Philippines has been the karaoke capital of the world. But in reality, it's not just the singers who have to care for their vocal health. How would you be able to give practical tips to our audience regarding their voices and how to keep it healthy and strong?
You're right, Dr. Jing. We don't only have singers as our patients. Singers are usually what we call the elite vocal athletes, as we call them. We also have our teachers, the clergy, lawyers. So we do have a lot of patients that we see. Even call center representatives, they commonly have voice problems. So we want them to see us at the very slightest problem because we can prevent it from worsening.
I see.
So we encourage voice professionals, even mothers with a lot of children or one child who is hard to take care of. So that's an example of a voice professional.
So it's really very important in our daily lives. In fact, it's our voice, Doc, diba? It's not just something that we should take for granted.
Correct. So if pianist has the piano as his instrument, violinist with the violin as her instrument, we have our voice as our own instrument.
Everybody needs to have a voice. Okay, Doc Maita, could you please delve deeper in the common voice disorders that you see in the clinic or that's prevalent in our country?
Still, the most common would be your usual laryngitis, which may be usually infectious in nature, viral, bacterial. So patients get hoarse when they do have an upper respiratory tract infection. But also for voice professionals, those who tend to abuse and misuse their voice. So you have vocal fold nodules, polyps, cysts, etc., which need to be addressed. So they need to be seen properly so that a proper diagnosis can be made. So these are the usual problems that we see. One other thing, I'm sure a lot of our listeners and our viewers would agree, is what reflux or laryngopharyngeal reflux, acid from your stomach, as it reaches the throat, can actually affect the voice.
That thing about our stomachs that come up, no? Yung acid that goes up, it can also affect the larynx, not just our food pipe.
Correct.
So, doctor, would be polyps, vocal fatigue, nodules, laryngoesophageal reflux disease.
Correct.
So, anybody can have this problem, and it's really important for us to address this in a timely manner. Like any body part, I believe the vocal cords should also have an exercise regimen. Or how can we exercise our vocal cords?
Correct. So this is what we tell patients. Your vocal folds are ultimately muscles. So like an athlete who needs to stretch before, engaging in any sport, we do need to warm up our voices. And we can do that properly by doing vocal therapy, vocal warm-ups, because we do have our speech-language pathologists and singing voice therapists who work very closely with us, and they're the ones who really go into the details of doing exercises and therapies. But for us doctors, for us ENTs who deal with voice problems, we stress that you do need to warm up your voice. Some example maybe if during a choir practice, you need to do scales, like the do, re, mi. Can I do it here?
Go, Doc.
It's like, when you ask the patient to do scales like E, just by doing that, you're trying to, stretch your voice so that it warms up before you use it. So not only for singers, if we have patients who are teachers, so we want them, they teach 8 hours a day?
Yes.
So we want them to, before starting teaching, you do these warm-ups. Even if you're not a singer, you're going to use your voice for 8 hours.
I know, Doc. Like, in the clinic,
exactly.
I feel that by like 3 p.m. when I start at 8, wala na akong boses.
Correct.
So, Doc,
Correct.
do I have to exercise?
Yeah.
I will have to ask our
like,
speech pathologists and our vocal trainers for that.
Right. It's like when, diba, your piano has to be tuned.
Okay.
Your violin has to be tuned. Your guitar has to be tuned before you start using it. Diba pag bands, before they start, ang tagal-tagal nung prepping nung the whole band. It's similar to your voice. You really need to warm it up before you use it.
That's nice to know, Doc. So, Doc, what steps can they take to ensure that they receive the assistance and encouragement needed during this journey?
Well, first of all, they need to be aware when to have a consult. That they shouldn't take changes in voice quality lightly, especially if you're using your voice every time, because the longer you delay consultation or checkup, it may become permanent or may be hard to treat. We'd like to, say that there are ENTs who can look at your throat. If they need a voice specialist, then we are here for them. And as I said, we do not only act individually. We, us voice doctors, are very dependent on our speech language pathologists and therapists, because we know that it's not only medications that will help, but learning how to use your voice properly is very, very important for vocal rehab and good voice use.
Because, Doc, diba, when you speak, it's not just your vocal cords as well. It's I believe it's like everything from your diaphragm
Correct.
up. So those are also part of the rehabilitation.
Yes.
Okay.
I'd like to, emphasize that your breath support is your powerhouse of your voice. So sometimes some singers, that's the only thing that's wrong. There's nothing wrong with their vocal folds. It's just that they cannot sustain their voice. And just by teaching them how to breathe properly,
I see.
they can eliminate their voice issues actually.
Kaya pala, Doc, I have heard of this one singer in the Philippines, one of our most popular singers. I read somewhere that her training when she was young was she would be in the ocean with water up to here, and then she would vocalize and sing, and that's the reason was for her to expand and strengthen.
Correct.
So that really works.
Yes. Your vocal, your respiratory capacity is very important for voice use, and there are exercises that can develop that. I think that's the basic that speech language pathologists and therapists teach.
Much like other conditions, Doc, no, it's not just limited usually to one problem. That's why it's really good for our patients with symptoms or with some medical concerns to consult your physician, because it might not be as simple as we think. It might not just be, for example, it's not because of a vocal cord problem. It could be another issue like oral or
yes. For singers, sometimes it's the way they stand, it's the way they position themselves on stage. It can be as simple as that. For our music theater patients, sometimes they don't have anything wrong with their vocal folds. It's maybe just the positioning that they have during the show. For example, they're performing and they're singing and they're dying and they're lying down. That's very vocally taxing. So just by teaching them how to do it properly and in a healthy manner, it can be, beneficial for them.
Very helpful tips, Doc. Doc Maita, yung yung always clearing the throat, is that bad for our vocal health?
Well, actually, yes. It's vocally abusive. It's a vocally abusive behavior, because just imagine your vocal folds slam against each other whenever you do that.
I always do that.
When you speak or sing, they come together and vibrate.
Okay.
So very mildly or gently. But when you clear your throat, they actually slam against each other. So yes, that is a vocally abusive behavior which we want patients or voice professionals to get rid of.
Okay, so let's remember that. Doc, any other tips to improve our vocal health?
Okay. So we want to know firstly what can make your voice bad. So commonly, it's aside from the infections which I mentioned earlier, there are what we call vocal misuse and abuse issues.
Okay.
So abuse would be shouting at an inappropriate loudness, like in a basketball event and you cheer, so that's vocally abusive. Misuse is when you speak too long. For example, like when you're a teacher and you don't have very time breaks because you need to rest your voice.
I see.
So misuse and then speaking at an inappropriate pitch level. We have actors who try to modulate their voice like this, but it's abnormal for them.
Oh, I see. And
so,
it's going to hurt. It may hurt. It may hurt the vocal cords.
Just being aware of this. And some singers, like we have patients who are in a choral or a chorus. So we have patients who are in a choir. So sometimes pag kulang yung alto, but they're actually soprano, so the choir master would say, no, you sing alto. But it's not normal
it's not
for them.
normal.
So, or it's not usual for them. So that can be an misuse issue.
What about, Doc, like alcohol drinking? Are vices going to hurt the vocal cords or the voice health of our patients?
Yes, of course. Smoking, for one, I don't think there's any good thing that comes from smoking. But smoking, it's the heat, it's the metabolites, so not really very good for the vocal folds, can cause dryness, irritation, swelling. Alcohol does not directly affect the voice, but it can cause reflux. I just had a patient who said that he takes a shot of whiskey every time he sings, before he sings, because he feels that it warms up his voice.
Oh, I see.
Of course, I need to change that because
mindset.
Well, alcohol does not have a direct effect on the voice. It might actually trigger a reflux event.
Which will hurt the vocal cords.
Which will hurt the vocal
eventually.
folds.
All right. So thank you, Dr. Maita, for joining us today. I learned a lot. I hope you did too. And this is Jing. Thank you for tuning in to MD in Focus. Remember, your health is your greatest wealth. Always consult your St. Luke's specialist for more reliable health information. Remember to click the follow button, and until next time, stay well.